watching Morning Coffee. This morning's Morning Coffee hot topic is with Dr. Jessica Shepard. And it's hard to believe in the world today that there are any topics that are taboo. But unfortunately, that's not the case when it comes to women's health. And Dr. Jessica Shepard is here to help us tackle taboo topics in women's health. So, good morning, Dr. Shepard. How are you this morning?
I'm doing really well, Shar. How are you?
I'm good. Thank you for joining us on Morning Coffee. I'm a woman, and I think I actually suffer from some of those taboo questions as well. So, why are so many women's health issues still taboo?
I think, in general, when we think about where the the topic revolves, people feel a little bit maybe shamed or guilt of bringing up topics that in the past and are not very highly discussed topics. But again, it's finding someone who you can talk to about those issues comfortably. And sometimes going into the office, you have that what we call that white coat syndrome. It's that sterile room with the four walls on the exam table. So sometimes bringing up those specific topics when it comes to reproductive issues, bleeding issues specifically, you don't feel comfortable talking about that.
Let's talk about bleeding issues. I know that AUB is very prevalent, and many women are hesitant to discuss it, even admit that they have it.
Mm-hmm.
What exactly is AUB, and what are some of the new treatments that are out there now for it?
Yeah, so women in general, I think we're caregivers. We take care of so many things, whether it's our kids, our families, our jobs, and so a lot of times we neglect what may be going on with us individually until it becomes very obvious that it needs to be taken care of. So AUB actually stands for abnormal uterine bleeding. And so that encompasses any changes that you have in your cycle, whether it's with the frequency or the duration, meaning it's lasting longer than it typically has, or actually the actual heaviness of the bleeding. If that's heavy, becomes heavier for a woman, those are reasons why you would want to talk to your doctor about ways to either discuss why it's happening, and once you find out why it's happening, what you can do to change that or correct that or treat that.
So, are there new treatment methods for AUB now? I mean, I know back in the past it was a hysterectomy was pretty much the only option, but I'm sure there's so many other, options at this point.
Yeah, Shar, that's a great point that you brought up. I think in general, from historical perspective, women really thought that hysterectomy might be the only treatment once they get to a certain point with abnormalities in their bleeding. But we do have so many different technology advances today, whether it's with medications, procedures, specifically for women who have issues with bleeding in between their 40s and 50s, coming up to menopause and are finished with childbearing. The endometrial ablation technique and a NovaSure technique done to actually treat the lining of the endometrium. And the great thing about this is that it's a same-day procedure. So you go in, you can have it done in the office or the operating room, and you go home the same day. And recovery is 3 to 5 days, as opposed to a hysterectomy, which might be anywhere from 5 to 8 weeks, which is completely different. So, yeah, I think there are a lot of changes and options, and that would be a great option for women. But again, they need to talk to their doctor about what the changes in their cycle is and if they're a good candidate for that procedure.
So, what are the top 3 questions that every woman should ask their doctor?
Top 3 questions that women should ask their doctor are: one, what are the screening tests that I need done for me, depending on what age I am, where I am in reproductive life. Also, if they do decide to childbear, where they are as far as timing with that, and if they need to talk to their doctor about any childbearing issues. The other thing is abnormal uterine bleeding. What to do with it, and why am I having these changes that the woman may or may not be having? Because abnormal uterine bleeding actually is probably the number one complaint that women come into the office for, and so you really want to be able to discuss those changes so you can figure out what therapies would be best for that patient. And so a good conversation with your doctor should make sure that it encompasses any bleeding issues, and also the pap smear as well, making sure that you're getting your pap smears done to decrease risk of cervical cancer.
Very, very important. Make sure you go at least once a year, and if you're experiencing any changes, make sure you call your doctor as soon as possible and get in there and get an appointment scheduled. Um,
Absolutely.
Dr. Shepard, where can women find out more information on all of these topics?
Yeah, so to find out more information about bleeding issues, that they may want to get more information on how to get an endometrial ablation, the NovaSure done, is to go to actually www.novasure.com. That's NOVASURE. So they can find out about this new technology. It's newer, meaning it's been around for about 10 to 15 years. However, a lot of women do not know about it, and it might be a great option for them. So to go to that website, get some information, and then bring it back to their doctor so they can sit and discuss, is this the best thing for me?
That's great information. Dr. Shepard, I want to thank you so much for being on Morning Coffee.
All right, thanks so much.
You're welcome. Have a wonderful day. This is Charlene Chamberlain. Stay tuned. We'll be right back.